Hello, it's Dr. Tazinski with Cutting Edge Vasectomy, no needle, no scalpel vasectomy with offices in Grand Rapids, Lansing, and Rochester Hills. I want to talk today's video about a quick and dirty all things vasectomy process. Before we get into that, I want to touch very briefly about male anatomy so we understand what we're going after here. Sperm are made in the testicle, matured in the epididymis directly behind the testicle, and travel north through a thin tube that feels like al dente spaghetti up north to what is essentially a holding tank. In that holding tank, sperm is a small component, about 2 to 5% of what comprises semen. So when guys ask what changes after vasectomy in terms of ejaculation, the quick answer is essentially nothing. Semen comprises about 2 to 5%, a small component, about the volume of semen that is ejaculated. Switching gears now to what is a vasectomy. Any surgical procedure can be broken down into 3 components: anesthesia, access, and execution of the procedure. Anesthesia traditionally is done with a needle inserted through the scrotum, advanced to the vas deferens to perform a spermatic cord block, and an anesthetic is injected. That's done traditionally on both sides. That works great, it gets the job done, but most guys prefer no needles to their jewels, and we recognize that. So at Cutting Edge Vasectomy, we use a no needle technique, a hypospray device that when the vas and the structures around it are manipulated anterior to the scrotum, this device delivers a pop of anesthetic that penetrates through the tissue in and around the vas deferens. The benefit of this, of course, is less pain. Most guys describe this as a flick to the skin or a rubber band to the skin. It's obviously less painful than a needle to your scrotum. The other benefit is we're able to use a lot less of anesthetic, essentially a fifth less, which means there's less swelling to the area, and that just decreases the risk of complications. Once you're numb on both sides with the hypospray device, that brings us to the next step, which is access. Traditionally, a vasectomy is done with a scalpel, where the vas deferens and the structures around it are moved laterally, and a scalpel is used to make a 1.5 inch incision on both sides, the contents of which are pulled through, and the vasectomy is done that way. Most guys would prefer no scalpels to their scrotum and their jewels. We recognize that, and so with our technique of the no scalpel component, we use a specially designed pointy device that goes over the middle anterior of your scrotum and is stretched to about 3 millimeters. From that 3 millimeter point, we use a series of specially designed clamps to get that vas deferens into the clamp through the 3 millimeter puncture, at which point we're able to proceed to the execution component. There's a lot of ways to go about executing a vasectomy. Vasectomy has been around for a long time, and there's a lot of literature that breaks down what is the best way to go about it in terms of complications and in terms of potential failure. The American Urological Association, in my opinion, has done a great job compiling this information. I'll put the link from that article below if I can. It's also on our website, cuttingedgevasectomy.com, where you can read and compare from all over the world kind of breakdowns of what is the best way to essentially do a vasectomy and seal off the tubes for good. That being said, at Cutting Edge Vasectomy, we've essentially compiled and combined the top 3 ways of doing this. Number 1, we sever the vas deferens. the highway, if you will, that carries sperm from the testicle up north to that holding tank and combines with semen. We sever the vas deferens, and that probably would be good enough, but probably is not something you want to hear from your vasectomy doctor. So step 2 of our technique is we then take a heat cautery unit that heats up to 2000 Fahrenheit, advance that through the abdominal component of the vas deferens to cauterize the interior of the tube. That will scar off about 1 centimeter of the tube, essentially blocking the ability, if the ends were ever to connect, from sperm traveling through the vas deferens. And that would probably be enough, but probably is not a term you want to hear from your vasectomy doctor. So the third step that we do is fascial interposition. Once that abdominal end is buried, we take tissue over the top of the tube that's already scarred, and we use a small hemoclip, that's a titanium clip a fraction of the size of a grain of rice, to permanently seal off that tube from ever being able to come into contact with the other side of the vas tube that we've just severed off. Some guys are curious, why is it that we use titanium clips? Well, the literature is clear that they are the least reactive. An alternative way that sometimes needs to be done, depending on guys' anatomy, is using suture material. Frankly, the risk you run with suture material is that it has the potential to be reactive to the tissue around it. That means swelling and sometimes discomfort after the procedure. Titanium is not reactive. Titanium will never slip off, unlike a suture that can break down over time. And although this is titanium, the metal is so small that you should never be able to feel it. You certainly will never set off any metal detectors, and it won't preclude you from getting any sort of images down the road, like an MRI. Separate the vas deferens, cautery of the abdominal end to scar the tissue, and then fascial interposition with a small titanium clip that's designed to stay on there forever. That's the end of the vasectomy, but it's not the end of the vasectomy journey. We talked about the holding tank up north that will hold sperm and semen where it's combined, and it will hold it in that tank for a good 90 days. So when guys leave the vasectomy clinic, they're shooting live rounds. And they're doing so, we presume, until about 90 days. At the 90-day mark with a conventional vasectomy, guys would go to a lab, give a sample at the lab, and that sample needs to be processed within 1 hour. That works, but the follow-up rates for that are quite abysmal, and it leaves guys with this sense of uncertainty: has my vasectomy worked or not? We've broken down the process to, again, just keep it simple for guys. We've partnered with a third-party lab, which will mail you a kit. You can follow the instructions, leave a sample in the comfort of your home, mail that kit back to the lab, where it's then analyzed, and a doctor will review the report and be in touch with you. At 90 days, if that report comes back that there are no more sperm in the semen, you're all clear, and that is the end of your vasectomy journey. If you have any questions about this procedure, you can check our website, cuttingedgevasectomy.com. Feel free to put comments below, and I'll do my best to answer them. Have a great day, and remember, with a vasectomy, you're not broken, you're fixed.